I'm now going to have our next guest, Stanley Erck, and let me introduce Stanley Erck. Stanley Erck is the CEO of Novavax. Novavax, as some of you may know, is a Gaithersburg company that is now one of the companies that under Operation Warp Speed has received a fair amount of money from the federal government and is working on a vaccine for the coronavirus. Mr. Erck is a person who is native of Southern California. He is a graduate of the University of Illinois and a graduate of the University of Chicago Business School, Vietnam War veteran, and he's also been the CEO of a number of biotech companies, and he's been the CEO of Novavax since June of 2000 and April of 2011. He joined as a director in June of 2009. So he's coming to us today from Colorado, and you can hear me, Mr. Erck?
I can hear you just fine. Thank you for having me.
Thank you very much. So your company was a small company. I can't honestly say it was that well known, even to those of us who live in this area. So all of a sudden, you got an enormous amount of money, $1 billion plus from the federal government to help produce a vaccine for coronavirus. How did the government know about you, and what was your company's expertise that enabled the government to feel comfortable giving you $1 billion plus to develop a vaccine?
Well, it's like the commissioner said, everything's based upon data that you generate. And since the 10-year period that I've been with the company, we've actually been making vaccines against emerging viruses throughout. This is not our first coronavirus. This is our third coronavirus vaccine. And we've been making influenza vaccines. We just had a pivotal phase 3 flu vaccine unblinded in March, which showed dramatically better data than the comparator vaccines. We've gone through Ebola vaccines, and so we've been doing this for quite some time, and there hasn't been and we maybe not known as well because there hasn't been a pandemic, and so we've been practicing for this for some time.
All right. Well, before
all of these projects, all of these vaccines that we've made, the beauty of this is use the same platform. We make a protein in a certain manufacturing system, and we mix it with an adjuvant, and both in flu and Ebola and coronavirus. And so we get a lot of base data on efficacy and safety from these vaccines.
So what can you tell us publicly about the likelihood that your virus vaccine will be ready to be approved by the FDA at some point in the near future? Is it months away, a year away? How long do you think it'll be before your vaccine can be on the market?
Well, the first part of your question is maybe what level of confidence we have that the vaccine is going to work. I personally think that vaccines will work against coronavirus, and so that's a huge statement because it's going to be a vaccine that's going to stop this pandemic. So why do we think that we're progressing on a pathway toward that? Is everything that we've done is consistent along the pathway of developing the coronavirus vaccine and consistent with what we've done with the other vaccines. In particular, this phase 3 flu vaccine was a good predictor of the type of immune response and safety we'll get. But we go through the steps. You start making when we got the gene sequence back in January, we made the gene sequence, we put it into mice, which is the standard model to see that it's safe. And then we go into non-human primates. And I think what got the attention of the rest of the scientific world is we got dramatically good neutralizing antibodies, a measure of immune responses in non-human primates that almost always predicts what will happen in humans. And so that was the first real demonstration, and you can actually challenge these animals with coronavirus and show that your vaccine protects it. We've done that, and we've done it in mice, we've done it in the non-human primates, and now it's parlayed into the first human trial. And when we look at our phase 1 data, and against all the other phase 1 data, and you look at immune response, neutralizing response, compared with safety, and then the third thing you have to have is you have to be able to make it. And you have to be able to make it at large scale. And so we have a vaccine that's stable, that can be distributed at refrigerated temperatures, and has these immunogenic and safety profile that we believe is as good as anybody's. And so when is going to happen is what your question was targeted toward. We're scaling up now. We're about to from the last 2 weeks to the next 6 weeks, we've got 6 major trials coming on, 3 of which will be phase 3 trials, 2 of which will be phase 2 trials in 5 different countries. And it will get us data later this year, we believe. And so I can't put a timetable on it because it depends upon, in the countries that we pick, how much disease is circulating at the time we're doing our clinical trial. Therefore, how many cases do you collect? And everybody's doing the same trial. You can't predict which date. You try to get to a certain number of cases, you unblind, and then you see what you got.
Why do you use why do you do phase 3 or phase 2 outside the United States? Is there some advantage of doing it outside the United States?
I think so. I think we're dealing with a global problem. We're manufacturing outside the United States. We're testing outside the United States. It's not good enough just to solve the coronavirus problem in the United States. And so you need to have product that can be distributed globally, number one. Number two is the virus is circulating at different levels in different countries. And we started a trial in South Africa because it was predicted that they would have a very high rate of disease. And the premise here is that if there's no virus circulating, if you go into an area where there's no virus circulating, you can't show your vaccine works. And so you go to a place where you predict there's high levels of transmission. South Africa was one, the UK was one, the US is clearly one, and we'll be going into India as well. And so you pick, it gives you more chances of showing how well your vaccine is working or not working.
So for a vaccine to be considered effective and to be working, does it have to work 100% of the time, 90% of the time? And what are typically the side effects that people might have to worry about with any of the vaccines that are now being prepared?
Sure. The standard side effects, I think, is, as the commissioner said, is you have sore arms, you have malaise or fatigue for some short period of time. That's headaches, and that's more typical of the type of side effects you get with vaccination. And what you do is you compare it to people who don't get your vaccine, people who get placebo, because people who don't get your vaccine and get placebo have malaise and they have headaches, and you try to see what the difference is between the two. And so I'm sorry, I missed the first part of your question.
So you're saying that there's likely to be side effects, but there'll be side effects that are more or less tolerable.
Right.
Okay. So back on how, for people who are watching, they want to know how you got the grant. You're not as famous as Pfizer or Merck. Now, Moderna is not as well known as maybe Merck or Pfizer or AstraZeneca, but you're not a very big company. Before you got this grant from the federal government, your market cap was roughly under $100 million. Now it's $4.6 billion, which is a big increase. So how does one go to the federal government and say, hey, I think I can produce a vaccine and give me some money? How did you all do that?
Data. We showed them the best data in well-regarded scientific models, non-human primates. We showed the best data. And so everybody looked up and said, wow, that's better than the data that's been shown by Pfizer or Moderna. And it's manufacturable, and it's safe, and it's from a platform the company's been working on for a decade. And so it's not just brand new, it's data that shows and that's what it is. It's all data driven. So
when you got word that you were likely to get this grant, I don't know how it worked, but obviously it was going to have a dramatic effect on the market value of your company. Your market value is up about 5,000% since December. How do you keep that information private until it's publicly announced? How do you avoid people trading on that?
Well, I mean, I've been in biotech for 40 years. We've always have had the balance between data that you know and data that you announce, and you have to use judgment as what the timing, when are you confident that the data is material, so therefore you have to announce it. And you often, like we did, go out and get peer-reviewed analysis of your data. And we've had a couple of New England Journal papers published just in the past few weeks. And so that's the only way you can do it.
Right. So when your vaccine, let's suppose it is approved, and who decides who's going to get it first? Is it Americans? Is it older people? Who is going to decide who's going to get it first? And do you have to listen to what the federal government says in that, or you can sell it to anybody you want to sell it to?
Well, there'll be tension. And one of the reasons we set up a global manufacturing platform is such that we can get product distributed globally. As I mentioned, this is a global problem. It's not a problem just in solving it in high income countries. It's low income and middle income countries. We have 7 different manufacturing sites in 7 different countries that probably by next year can make upwards of 2 billion doses, and it will not be blocked by closing borders. And so therefore in the US, we have product that we've made in the US, and we'll rely upon the CDC and the ACIP to help figure out how to distribute product, and the same organizations in Europe. And we work with Gavi, the Global Alliance for Vaccines, which distributes products to 97 different countries in the low and middle income countries. We're going to supply product for all of those.
Hey, your company's based in Maryland. How about giving it first to people who are also living in Maryland? How about that?
I'm all for that, but I don't have all those choices.
And what will it likely cost somebody? Let's suppose your vaccine comes out and I say I want to get it. What do I have to pay for it?
Yeah, and it depends on whether you're getting it through the first. I think that, like flu, I think that the ordinary person is not going to be paying for the vaccine for some period of time, certainly not during the pandemic influenza period.
So your company was modestly sized and not that well known in the general public, I would say. Now it's pretty well known. How has your life changed since that time? You have people from high school calling you up, telling you they really like you a lot more, and can you get them the vaccine? How has your life changed?
Yeah, well, there used to be Saturdays and Sundays.
So now you don't have any much time. All right. But
no, but that's not true of just me. That's true of my whole company. But look, we're the easiest place to recruit the best people to right now. We've everything we've done, all the data that we've shown shows that we have a solution to this pandemic, and this is a once in a lifetime opportunity. We're getting the best of the best scientists, experienced and not just out of school, coming to work with the company and solve the problem. We've got enormous problems in terms of scaling up, in terms of supply chain logistics, getting 7 different manufacturing sites to produce product and distribute it around the globe. We have enormous problems ahead of us, but we've got great people joining the company. It's
okay.
all encompassing.
Well, a lot of people have been working out of their home because of the COVID situation. Right. But if you're producing a virus for the COVID crisis, do you have to work out of your home as well? So have you been working out of your home, and is that harder to do or easier to do when you're in your business?
No, I have to have people in the lab. We have people. So we've got basically 3 different sets of labs. We've got them in Gaithersburg, where they do assays, and people have to physically be there to do assays. So we stagger work times. We just bought a manufacturing site in the Czech Republic. We've got 150 people that are going to be 200. It's about to start producing at a rate of 1 billion doses a year, and we have to figure out how to stagger those work. People have to come to work. I talk with, in Prague, we talked with the Prime Minister a couple times and said, look, we've got to let our people make sure they can get in country to work there. I can go there, and the same thing in Sweden, where we make the adjuvant. We have to have people. And for those who aren't physically on the production line, we work from home.
So the information about how your trials are going is obviously very confidential, but also could move your stock dramatically. So how do you make certain that very few people know what the trials are showing, so that inappropriate actions are not taken in trading your stock?
Well, that's something throughout the history of our company we've dealt with. It's you blind your data. So we always do placebo-controlled trials. If you get great results for immune response, I don't know whether it's from the placebo or not the placebo until we unblind it. And then it's a very defined process of unblinding. You get in a closed room for a few days, run the statistics, and you get your answer. So nobody knows the true answer until you unblind it.
Are you also manufacturing a flu vaccine?
We are. I mean, we have this great phase 3 unblinded pivotal flu trial that we got in March, which everybody knows we need a better flu vaccine. We've been working on it for many years. And just coincidentally, I mean, in January, when I was looking for that plant in the Czech Republic, I was looking at it to make flu vaccine. And instead, it's now a COVID vaccine. And so, but we have, I think, approvable phase 3 flu data. And my frustration is that because of all the capacity of manufacturing has been sucked away by COVID, I've got to find a way to do flu. So we're working on it. We'll get there, but COVID makes the project take a little longer.
So with the polio vaccine, many people watching probably are familiar with that. That vaccine came about by taking a part of a live virus and kind of making it a little bit inactive or not dangerous. Right. Why is it with this virus, that same technique, which worked with polio, doesn't seem to be one that people are using? They're doing different techniques. Why? What's wrong with the technique used in the polio vaccine for the coronavirus problem?
Well, it's the beauty of our technology. We don't even work with virus. We never work with virus, so you don't have to build a plant that has all the safety precautions of escaping virus. We never, ever work with a live virus in our manufacturing process. We actually sequence the gene for the protein that we want to make. All we're making is a protein. Remember, you've got a virus with RNA, you've got proteins on it. Viruses don't live by themselves. That protein, they have to infect human cells. In the case of coronavirus, it infects it by this spike protein, the S protein. If you can just take that protein and put it in your arm, and your immune system says, that protein, that something's wrong here. There's something that looks like coronavirus, makes antibodies to it, so that you have a plethora of antibodies that when you actually get real virus, it blocks it. And so it blocks it, so the virus can't infect your respiratory cells, and that's what immunization is. So that's the modern technique of not using. You don't have to use virus anymore.
So let's suppose a number of virus vaccines are approved by the FDA: Merck, Pfizer, AstraZeneca, and Novavax. And I have to go to my doctor and I say, I want a virus vaccine, and I got 4 choices. He would say, let's say. Why would somebody say, I'll take one from Novavax, which you're not as well known as? Why wouldn't somebody say, I'll take one from Merck because they've been around longer, they're better known? What's the argument that it doesn't make a difference if you get it from Novavax or Merck or AstraZeneca? How do you compete with those well-known companies and saying your vaccine is likely to be as good as theirs?
So it's a challenge. It's a challenge for little old Novavax to go up against Merck and Pfizer and say their vaccine is better. But the beauty is the data will be there. When we get approved, we'll get approved, and there will be a dossier, a packet of data, which will say, here are the 4 or 5 types of immune responses we get with each of these vaccines. And they'll say, here's the data profile of each of these vaccines. And their doctor will help them make that judgment that, so if you don't mind, I'll use Novavax as the example. Say Novavax gets 80% efficacy, and we have a really clean safety profile, and somebody else has 65% efficacy. Well, if both, so that makes it sort of obvious to pick. But the fact is we're gonna roll out vaccines, and we have to have multiple vaccines. Right. Of a vaccine company that doesn't want another vaccine company to be successful at some degree, because there's just not enough capacity to get it out there. But as we get through the pandemic into the more traditional annual vaccine, then people will decide based upon the data that comes out, and it'll be published. All the data will be published.
So when you say somebody has an 80% efficacy, that means that 80% of the time it works and 20% it doesn't. But in that 20% it doesn't, does that mean that they have some really bad side effects, or it just didn't have any positive effect?
No, I don't think it has anything to do with the side effects. It just has, they didn't have their immune response, didn't respond as well.
All right. So let's suppose after the presidential election, whoever is the next president, the current one or President Biden, they say, we want to start all over again and prepare for another pandemic in case another pandemic is coming. And we want to do it better than we did this pandemic. What would you advise the next president of the United States or about how vaccines might be better prepared and tested than this particular pandemic? Was there any advice you would have to the next president about how to make things better?
Well, I think that I'm probably a good person to ask the question because in my last two companies over 20 years, I've been trying to make pandemic vaccines. We started 20 years ago with an H5N1, started to build that up, and H5N1 sort of went away. And there was this lull. Nobody would fund any pandemic vaccine work. Then H1N1 came in 2009, big flurry of activity, then went away. And there hasn't been any pandemic funding in the past 8 or 9 years. And because now we've got the big one. So what'll happen next time? I don't know. I mean, it may well be that they just don't have they continue that process. They go back to, because what you have to do to prepare for a pandemic, one of the things you have to do is you have to build a base of production and keep it warm where no products are coming out of it. And it just depends on whether you have the will to spend, pick a number, $5 or $10 billion a year just to keep a warm base when product will never come out of that until there is a pandemic. But
So, I see. So think with your vaccine, let's suppose it's approved and I get a shot and then I guess I need a booster shot or whatever they call it, a second shot.
Right.
But how long did the vaccine last? Does it last for a year, 6 months, 2 years, a lifetime? How long do they typically last?
The answer is yes. We don't know. It's
know.
one of those. It will last for one of those. We don't know. It could be an annual shot. It could be a 5-year booster. We don't know.
Okay. And if somebody is watching here today and they say, okay, I've listened to Mr. Erck and I think he knows what he's talking about. I think his stock is a good buy. I'm going to go buy the stock. What you think your stock's a good buy at this price? Because it might have built in all the great effects you're going to have if you actually get approved.
What do you think I'm going to say to that?
You can't answer that.
It's of course I think it's a good buy. I think it's we have not only a lot of pandemic coronavirus vaccine to make over the coming years. We've got almost a perfect flu vaccine that hasn't even gotten to the market yet. And we've got an RSV vaccine, which is probably equally important. So we've got a pipeline. And this is one example of the pipeline.
Okay. So the main message that, let's say, you would like to convey to all the people that are watching about your company and about the vaccine process is what? If you were to summarize the main message you would like people to take away from our conversation, what would be the main message you would like people to walk away with?
So the platform, this making recombinant nanoparticles with makes a very potent, safe vaccine. And there are a variety of major targets. The largest cause of hospitalization of children in the United States and globally is RSV. We have a vaccine for that that's ready to prove that again in phase 3s. We've got flu vaccine, and we've got the capacity to get through this coronavirus situation and build on that. And so call us just the best respiratory vaccine company. That's a big market, and that's a big accomplishment. Use that same platform for other viral diseases. So there's lots of opportunity for.
All right. Well, I appreciate your coming on. I know you've got a lot of other things you're doing, and I know you're in Colorado at the moment. So I want to thank you for making the time for us. And we're waiting to see when the vaccine is ready, and hopefully it'll be ready relatively soon, and I can get my vaccine. And you said you were going to make sure people who lived in Maryland get it first, right?
No, I got you. I'll get your address and make sure that you have it on the first production line.
Oh, I don't know if I want to be the first, but I'll be early. Somebody else should be first, but okay. Well, thank you very much for taking the time to be with us. Okay.
All right. Thank you.
Thanks a lot. Bye. So I'd like to remind everybody that this video of what we've just seen today will be on our website as soon as this is completed. And I want to thank everybody for tuning in. And again, I want to thank all of our sponsors. And I want to thank Mary, Brady, and others, and Judy for organizing all this. And thank you. We're finished today. And our next program will have the Postmaster General of the United States in 2 weeks. Thank you very much.